This is The Rounds Table.
Welcome back, Rounds Table listeners. This is John Fralick, one of your hosts. Today we're going to be doing a solo episode, this time from a publication from Nature Medicine. This was the liberal fluid intake versus fluid restriction in chronic heart failure, a randomized control trial. This was published March 30th, 2025. It was by Herman et al. So the research question here was, what are the effects of a liberal versus restrictive fluid regimen in patients with chronic heart failure in the outpatient setting? So why is this important? Well, we are always telling patients with heart failure to restrict their total fluid intake due to concerns that excessive fluids may lead to a volume overload state. However, randomized control trial evidence showing clear benefit is limited, and there may also be a signal for worse quality of life with restricted fluid intake. Guidelines speak to the need for additional research to understand the effects of fluid restriction, and so the researchers here set it upon themselves to try to figure it out. So how was this study done? Well, this was an investigator-initiated multi-center open-label randomized control trial done in the Netherlands. The patient population were patients with chronic heart failure for more than 6 months who had NYHA class 2 or 3 symptoms. They included both restricted as well as preserved ejection fraction. Some of the key exclusion criteria included recent hospitalization 3 months before randomization, a permanent pacemaker, changes in heart failure meds within the last 14 days, a GFR of less than 30, and hyponatremia with a sodium of less than 130. So for the intervention, patients were randomized 1-to-1 to either liberal fluid intake, which was fluid intake as desired without any maximum expectation. For the comparator arm, it was fluid restriction up to 1,500 mils per day. The primary outcome, which was assessed at 3 months, was looking at the KCCQ quality of life measure, and with this score, a 5-point change is considered small but clinically important. There were a number of secondary outcomes, one of which included thirst distress, which was assessed by the TDS-HF measure at 3 months, and this score is a 5-point Likert scale with higher scores indicating a higher thirst distress. They also looked at safety outcomes, and this was a composite, and it included things like death, hospitalization from any cause, or specifically heart failure exacerbation, the use of IV diuretics, change in heart failure medications, and acute kidney injury. So who was included in the study? Well, from May 2021 to June 2024, 504 patients were randomly assigned to liberal or restricted fluid intake. The average age was 69, 67% were male, and 87% had NYHA class 2 symptoms. Half of patients had a reduced EF, and about half of patients had been doing some form of fluid restriction before study participation. So what were the main results? First, just looking at the total amount of fluid intake between the two groups, the median patient-reported fluid intake was 1,764 mils in the liberal fluid intake group compared with 1,480 mils in the fluid restriction group. This was a difference of about 300 mils. In the restricted arm, about 42% of patients had intake above 1,500 mils. Now, for the primary outcome, which was that quality of life measure at 3 months, the score was 74 in the liberal fluid intake group compared with 72.2 in the fluid restriction group, which was a mean difference of 2.17. This corresponded to a p-value of 0.06 with a 95% confidence interval from negative 0.6 to 4.39. Looking at that secondary outcome, which was perceived thirst distress, this was significantly lower in patients in the liberal fluid intake group compared to those in the restricted intake group, with a mean difference in scores of 2.29 points. Probably most importantly, though, there was no difference between the groups with regards to any of the key safety outcomes. So what were some of the limitations here? Well, these results do not translate necessarily to those with unstable heart failure, those with a recent hospitalization for heart failure, or those with hyponatremia, as those patients were excluded from the study. Because of the open label design, there's always the potential risk for reporting bias. And of course, it was a bit of a smaller trial with a shorter follow-up window. So is this practice changing? Well, I think for my patients with stable heart failure, it is. There does not appear to be an obvious signal for harm when it comes to a liberal versus restrictive fluid intake. The primary outcome here was really more focused on whether there was an improvement from a quality of life perspective, and that was not confirmed with this study. But I'm actually okay with that because I think probably more importantly, there was not an obvious signal for harm. Well, this is just a one and done episode, so thanks a lot for listening. Before we go, some good stuff. YouTube channel to check out. This guy called starpowerdrummer. So I'm a big fan of jungle drum and bass. Historically, I would have said that those beats are they're not real. No one could actually play them in real life. Well, this guy proves me wrong. Check out his YouTube videos. It's just him playing along to some wild drum and bass tracks, jungle tracks, just fast drums. He even dips into a little bit of Aphex Twin. It's quite impressive. So if you want to have a listen, check him out. Well, that's about it for today. Thanks a lot for listening. We'll talk to you later. The Rounds Table is hosted online at medicinepods.com, your one-stop source for comprehensive internal medicine education and evidence-based medicine resources. We can also be found on all of your favorite streaming services. You can also follow us on Instagram, LinkedIn, and X.